the Bald Oncologist podcast series, featuring Dr. Malwinder.
Hi everyone, welcome to the Bald Oncologist podcast series. We are in the month of November, where men's health is always talked about. So in our studio today, we have Dr. Balan. He's a consultant neurologist. So we'll be talking today about prostate cancer and benign prostatic hyperplasia. So Dr. Balan, as someone age, BPH is very, very common. So how do we differentiate BPH and prostate cancer symptoms?
Yeah, thanks. It's a very good question that in the month of November, we're talking about this. The thing is, you must understand, this is, in a single gland, there's two problems. Yeah, prostate is a single gland, but it has got the enlargement of prostate, which is basically said as BPH, benign prostatic hyperplasia, and prostate cancer, which is completely a different spectrum of the disease, which is the cancer, which is your field. Okay. So what basically you must understand here is the prostate gland is a single gland, and if you will take it as okay, let's take it a size of a doku for Malaysians to understand, or an orange, mandarin orange, which is the simplest thing. Okay, so it's got the fleshy bit inside, and it's got the skin of the orange. Okay, so just for you to understand, just for the public to understand, that the orange bit is the enlargement bit, the one what we eat. It's basically what's going to happen is as you grow older, when you reach 50, it's going to start compressing the passageway. Imagine you drill a hole through the orange, and it's going to get compressed. As it compresses, it narrows the pathway with which the urine comes out. So progressively, your urine flow becomes slower and slower. Now, because it's happening at a very early stage and it's growing continuously throughout your life. So what's happening is they only pick up around 50, and that's when you feel like, oh, something is not right. But this doesn't happen overnight. It's not like yesterday you're perfectly fine, today suddenly everything just set. So that is a normal aging process in guys. Now, remember I told you about the skin of the prostate. That is basically where the cancer occurs, the peripheral zone of the prostate. So when that occurs, this is two different things, and this is where we have difficulty in identifying which tumor is basically, either is it a tumor or is it an enlargement. Now, what happens in the prostatic enlargement pit is you have poor urinary flow, you have frequency, you have urgency. That means whenever you feel, as some people just come and say, lately, when I want to feel like I want to pee, I have to run. And sometimes it's just very little comes out. This is one of the things that we have. And sometimes it's before even you open your pants, they tend to drip during the toilet. Most commonly happens when you go back home. As soon as you see your front gate, you want to run in immediately and go and piss because you know it's going to...
They're going to
tahan. Yeah. So that's the thing. So what we see is poor stream. Easiest way to find out is, most commonly the wives are the one who pick it up. The guys usually will not come and tell you that this is the problem. It's a male issue. No one goes to the coffee shop and talks like, me and you, we know how is your flow and all this. The only thing they will talk is, first thing the wife will come and say is, every night he gets up, frequently goes to the toilet, ons the room light, leaves it on, and then after a long time you hear the flush, and then you hear that stream, it just and then stops, then the stops. So this is troubling sign, because the husband usually comes and just sits down by the side. The wife's like, this is happening, this is not the way it's supposed to be. Then when you actually, sometimes guys will ask us, how do you feel? Oh, I'm fine, I'm perfectly fine. Okay, guys must understand, at 40, you start wearing glasses. At 50, the urinary flow problem. Yes. So this is basically like a clockwork for us. So sometimes we need to lead them into these questions. Now, all this I'm talking about is the benign enlargement. This is not the cancer bit. Yeah. Benign means non-cancerous bit. So easy, just go to the men's toilet. You ask them, do you stand up and pee? Say yes. So when you pee, do you need to wait for a little while? Because they need to calm themselves, get themselves ready before they actually start peeing. Younger days, you just walk in, shoot out.
Yes, all come out.
Yeah, easiest thing is you ask the wife. Now when he goes to the toilet, does it take longer than you to come out? Say, yes, I go in longer, I come out, and I have to wait for him to come out. Those days, the wife goes in, puts on the makeup and comes out. And now the lady used to wait for it. The guy goes in, have to wait for a little while. When they pee, they can't shoot the wall. Just ask them, can you shoot the wall? He said, no, it's just there. It just comes in a steady stream. It's like an old pipe in your house. However fast you open, it decided that's the stream is going to come out. It's going to come out that way.
Yeah.
Now, after that, you can also ask them, do you need to push start? Like an old car, you have to push start. You have to push to start the stream. Then intermittency is another one. It starts, then they wait for a little while. It starts again, then wait for a little while, it starts.
So it's not a complete.
Yeah, incomplete. Yeah, it just comes and goes.
Okay.
Then the other one is incomplete voiding. After peeing, they feel still simple. Do you feel something is inside? Yes, there's lots of urine inside there. I have to come back within 10 minutes and pee some more. I don't know where it's coming from. So these are the commonest things that we actually see. Now, when we talk about prostate cancer, that's where the whole thing changes. Because of the screening, availability of screening, here we try to educate people. We can't seem to be getting on to the masses, but as much as possible, people tend to go to the labs and do the blood tests and all that. We'll talk about that later. So what we see is, we tend to pick them up at early because the PSA is being done now. More people are aware of the something like this podcast we are conducting and all these things. People tend to be aware. But previously, most times we pick them up. It's actually a data that's available. 60% of the pickup cases are at advanced stage. Because, again, I'm telling you, the prostate cancer, it happens in the skin of the orange. I'm using orange. It doesn't work exactly like that. I'm just giving it just for the public to understand. Yeah. So it takes that. So instead of going towards the inside and blocking the flow, it goes outside. So it basically goes to the lymph node and the bones. So sometimes you'll be surprised that the prostate cancer is not identified by us, it's identified by the orthopedic person.
Because it can be bone problem.
Yes.
Okay.
So you see, they break the bone. The family will say that I was walking, he slipped, he fell, he broke his spine or broke his leg. Then we fixed it. Then the orthopedic guy said, no. When you take the biopsy, it's actually prostate cancer. Then we do the PSA, it runs in thousands and all this stuff. And then like, oh, God, what happened? We missed it. No, he's asymptomatic, he's fine and all that. So this is where we need to be sure which direction. That's why we tend to advise them to do the PSA levels so that we don't miss out on this whole thing of, catching them late. Most times, prostate cancer is asymptomatic, catches you very slowly.
Okay, so you'll never diagnose based on symptoms. You need to go for your regular PSA screening.
Unless it's actually spread to your bones.
Okay.
Then you get bony pains.
Yeah, but that seems too late.
That's already, by that time, you are the expert in that part.
Yeah.
So you know what's happening. So that's the thing.
So how do someone go for prostate cancer screening?
What we usually request is for them to do the PSA test. Speak to your GP.
Okay.
Simple as speak to your GP. Get a PSA test done. People in Malaysia tend to walk into the labs and get the PSA test. So when you do the PSA test, the only thing is they panic when they see the number. Okay, the number in Malaysia is fixed, is below 4. Now, it's secreted by the inner part and the outer part. So as you get cancer, when you get cancer, the PSA tends to rise.
Okay.
Now, I'm not saying that the PSA for people that are below 4, they don't have cancer.
Yes.
But people tend to think that as soon as the PSA goes up, it's prostate cancer. That is where the problem occurs. So as soon as the PSA goes, you must understand PSA can also go up if you have prostatitis. You have a very large prostate.
Okay.
Okay. And prostate cancer, the other one, and urinary tract infection.
Okay.
If I put my finger in at the back of your prostate and start pressing on your prostate, because when we do a rectal examination, the PSA can also go up to a certain extent. So the other thing that when you come to a urologist, people always make fun of us is we're putting our finger the back, when I go back to my family also makes this joke, your finger is always behind
someone's ass.
Yeah, someone's ass. So the thing is, the people ask, if you check the blood, why are you putting your finger in the back passage? Because what we always tell is, what we're trying to do is, the prostate, the easiest access to the prostate is to the anal region. It is just in front.
Yep.
So when we put my finger at the back, what I'm feeling is I want something smooth. I will always point at them. I want something smooth. I want something that is, it feels nice and soft. I don't want this lumps.
Okay.
Okay. As soon as there is lumps, I don't care what PSA you have.
Okay.
Your PSA and my
cancer.
Yes. I want my she's already firing. Okay, something is not right here. So this is what I'm seeing. This thing. Then that is when we decide, like, okay. So do not panic that as soon as you come, the doctor is going to go in
and do something
for you. Most often, most people that come in, all they have is enlargement of prostate. So when we treat them, suddenly the PSA is on a downward trend.
Okay.
So fast, prostatitis is so common. Yeah, it just goes down. So this is what we're trying to educate the public, that don't hold the results, panic and leave it at home, and everybody just ignores the whole thing.
Okay.
That's not the right way to go.
Okay, so that means the proper screening is actually by doing PSA and digital rectal
Yes.
examination.
Yes.
But if it is raised, it's not necessary it's cancer.
Yes.
Just go and consult with the urologist and discuss the case. It could be something normal,
Yep.
or your PSA is high.
Yeah.
Or if it's very, very high, then high chance it's cancer. Then we'll do a biopsy to confirm.
Yeah.
Right? And how often do they do all this screening? Is it every year, 2 years?
That's depending on your risk factors usually.
Yeah.
You see, the best thing is I usually tell my patient to do at least once at the age of 40. Once. So this is what we always tell. Please do PSA counseling. Come talk to us first. Talk to your physician. Talk to your GP. Talk to your oncologist. Talk to us. Anybody. Just talk to them whether you need to do or why it needs to be done.
Okay.
PSA stands for prostate specific antigen. This is a blood test, but it is not cancer specific.
Correct.
It's prostate specific. It is not cancer specific. So that is what we usually try to advise them.
Okay, so that's a good information for us. So if you haven't done your prostate cancer screening, you can actually contact the number below and get your PSA test done. Okay, so Dr. Balan, is there anything you would like to tell to our audience?
I would personally feel that if something like this, doing this podcast, I hope that more people come out and at least face the facts that, there is, not everything is cancer here. Yes, you're an oncologist, I'm a urologist.
Yep.
So I'm actually looking at as a bigger picture here. It's not that I'm going to ask you to do your PSA, come see the oncologist when you're going to start me. No. This is just what we're going to do is we're trying to sort your problem out. At least at a later stage, it won't be a shocker.
Yep.
Yeah, that's what we're trying to avoid. So please screen yourself and talk to your GP or your physician about these things.
Okay, so thank you so much, Dr. Balan, for being on our show today and for the insightful knowledge.
Thank you. Thank you for having me.
Thank you.
Thank you.
The Bald Oncologist podcast series